Hi, it's Nisa. In this video, I will tell you how to give or how to approach a case scenario and how we can dissect the questions scenario and to how to understand the question, to how we can correlate the options to find out the correct answer. Hope you understood about this overview which I am going to do. So, while approaching one case study, first thing is that we need to see the background information. What is the client information? For example, client's age, client's condition, and who is brought by the client to the particular department. Okay, so here it is written that the 3-year-old female client is brought to the emergency department by the caregiver, and it was at 11 o'clock, and we can read the question. Okay, we can read. A client is brought to the emergency department by her parents. Complaints of what are the complaints? Irritability, cough, hotness of body, malaise, reduced appetite, generalized body rash, and started behind the ears before spreading to the rest of the body. Okay, so that from this scenario, we should understand that the child is having irritability and she is having cough and body is hot to touch. She is fatigued. She has no appetite. She is having some rashes and which was started behind the ear and after that only it spread to rest of the body. Before spreading to the rest of the body, the initial rash was noted at the behind the ears. Okay. During the assessment, the client is alert but irritable. Okay, here we should notice irritable. And the client has generalized erythematous maculopapular rash. And also the client has bilateral conjunctivitis and bluish gray spots on the buccal mucosa. Okay, bluish gray spots are noted on the buccal mucosa. While auscultating the heart sounds are S1 and S2. Vesicular breath sounds ausculted bilaterally. Bowel sounds are normoactive. In the four, that means all the four quadrants, it is present. So, what is the question here? Here in this question, it has answered the client's most likely diagnosis as evidenced by assessing the scenario, we can see the vital signs also. Temperature, it's elevated, hypothermia, heart rate is elevated, tachycardia, respiration, tachypnea, BP, hypotension, low BP. 120 by 80 is the normal BP, but here the BP is low. And also the client is having some low oxygen saturation. Actually, it is now within normal limit, but that's the border 96%. So by assessing this scenario, we can read the question once again, complete the following sentence using the list of options below. So we need to look for a possible diagnosis. What is the condition here? The client is having irritability, cough, hotness of body, malaise. Okay, we should look for any significant symptom is there. Here we can see that the maculopapular rash, which started behind the ear and before spreading to the body. Okay, and also client is irritable. So when our body has some itching or rashes, we won't get what in a normal way. We will get irritable because of the irritation which is causing from the rashes. Okay. And also she is having what bilateral conjunctivitis, inflammation of the conjunctiva in both eyes. And also here we can see that bluish gray spots on the buccal mucosa. So but the heart sounds normal, breath sounds normal, and bowel sounds are also normal. Only the problem with this, this rashes, then she's having fever, malaise, appetite reduced only. So by assessing this, here we can see the maculopapular rash which has started behind the ear. Okay, so such we should look for the skin lesions. What is the significant skin lesion which has the maculopapular rash which originating at the behind the ear? So we can see the options rubella, measles, and varicella. By assessing the condition, we can see that This maculopapular rash starting from behind the ear is noted in the we can see in the measles. Okay, so hope so because it's rubella and varicella. The papular rash is different one, and it is evidenced by what here in bluish gray spots on the buccal mucosa. That is Koplik spot. Okay, in the Koplik spot are the significant symptom which can be seen in the measles only. So that only the child is not eating, child is having what malaise, child is having cough, irritability, and also the temperature is also elevated. So I am clicking selecting this. Okay. So while submitting the answer, we can see that yes, the possible diagnosis of this patient is measles. Okay. We should read the right answers as well as the wrong answer. So we can see the measles, which is a rubeola. Okay. And it's highly contagious viral infection characterized by what are the bluish gray spots on the buccal mucosa, Koplik spot, and here we can see that it's appear 1 to 3 before the onset of maculopapular rash, Gallus erythematosus. 1. It's starting behind the ear, spreading to the rest of the body. Okay. Child is having fever, cough, conjunctivitis, malaise, and also elevated body temperature 39.4. Okay. And the significant symptom which can differentiate from other rubella and varicella is the Koplik spot. Okay, that's these the spots on the buccal mucosa. That is the key diagnostic feature of this measles. And it's a prodromal phase, means the initial phase. We can see or monitor the symptoms, fever, cough, conjunctivitis, malaise, followed by malaise, maculopapular rash. And also it is spreading through the respiratory droplet. So early identification of the affected individual is crucial to prevent the transmission. So hope you understood about this question analysis. I just see the background information, read the scenario, check the vital signs, correlate with the options. Okay, correlate the options with the case scenario. Then I have chosen the correct answer. If you have any doubt, you can ask me.